Another story we wanted to take a quick look back at. It's a story that's been developing. It's one we brought to you last week, and we did not have much information on it last week. All we had was that, if you remember, that Indianapolis-based insurance company's CEO, that insurance company, One America. By the way, it's a $100 billion life insurance company with 2,400 employees, been around since 1877. So this is not just some fringe small company. Their CEO, Scott Davison, said that he was looking at his actuarial data, and he saw a year-over-year increase in deaths of people aged 18 to 49 of 40%. Now, he said a 10% increase over pre-pandemic levels would have represented a once-in-200 years catastrophe. And what we're seeing is a 40% increase. And that's like a once-in-an-800 or 1,000 years catastrophe. I mean, that is a catastrophe of a level that's impossible to imagine, right? What happened over the last year that caused this huge increase in deaths? Well, now we've got some folks looking into it now that he made this comment, and it kind of made some news. Of course, again, you're not going to see this on CNN. It's amazing. This is a huge story. Why aren't there some investigative journalists looking into this story? Well, of course, you got to rely on groups like the Epoch Times to look into it, and they have started trying to look into it. They've started questioning the various states and giving a state-by-state breakdown, and that's really makes the story even more fascinating when you look into it, because there's a huge variation between the states as to these changes in mortality rate. I've been racking my brain trying to figure this out. I can't find a common thread that explains this. I mean, it's just unbelievable what's going on. So if you think 40% is bad, wait till you hear some of the numbers for some states, because some states have no change, but some states have huge changes. I mean, it really differs very greatly. It seems to be the worst in the South, Midwest, and on the West Coast, whereas in the Northeast, it doesn't seem to be quite as bad. So, for instance, Texas had a 61% increase, of which a little more than half are supposedly attributable to COVID-19. So what caused the other half? And, of course, their Center of Health Statistics is looking at the data. They don't know in Texas. Florida, we had a 51% increase, and a little bit less than half of that was supposedly attributable to COVID-19. Of course, we don't know if those people died with COVID or from COVID or exactly what role COVID-19 may have played in their deaths. Nevada, 65%. D.C., 72%. What explains these numbers? We'll get you some more information on this when we come back.
And we're back on the Morgan Streetman Show. As we were going to break, Morgan, we're talking about seeing death rates climb across the country in various, not necessarily pockets, but just certain areas. And so why is that happening? And there are a number of reasons.
Well, yeah, I mean, they've done more than climb, right? They've just absolutely jumped through the stratosphere. That's what's mind-boggling about this. And in some states, so much worse than others. I mean, we told you about Texas and Nevada, over 60% increases. So if a 10% increase is a once-in-a-200-year catastrophe, what is a 60% increase? Okay? How about D.C., 72%? D.C.'s not a state, but 72%. It was the highest of all that they've checked. And, of course, D.C. doesn't currently have an on-staff epidemiologist at their office of the chief medical examiner, so they have stated that they have no present ability to analyze the data. So I guess nothing to see here, folks. When they get an epidemiologist, maybe they'll get into looking into why there's a 72% increase in deaths for people aged 18 to 49. It's mind-boggling. Arizona, 57%. Tennessee, 57%. California, 55%. New Mexico, 52%. Now, how about this? This is what I can't figure out. New Hampshire, 0. No increase in New Hampshire. Massachusetts, 13%. Now, 13% is obviously significant, but how come Massachusetts is 13% and Nevada is 65% and Texas is 61%, and Florida, where we all live, is 51%. What explains that difference?
Better counter?
Yeah, better counter. Well, I mean, this is supposed to be CDC data, so, can you trust the CDC? That's what I've been trying to figure this out, and one of the guys I talked to about various issues, that was his answer is, can you even trust the CDC data? But, I mean, come on. Can it be that bad? Can it be that far off? I just don't know. Something's got to explain this. Now, the One America CEO who first broke this story with the nationwide 40% change on actuarial data, he didn't have an explanation. None of us have an explanation. Nobody even wants to wager a guess at this point. And there's a lot more analysis that needs to be done. Folks, if you got an idea that you think could explain this, we'd love to hear from you. And you're welcome to give us a call today at 888-404-1010. One thing that the Epoch Times floated out there is part of the surge could be blamed on drug overdoses. But when you look at those numbers, it really doesn't quite explain it, in my opinion, but we'll see what actually comes out.
It could be a portion of it.
It could be some part of it, right? Because the increase in the 12 months ending June 2021 had increased to a little over 100,000 from the numbers of 72,000 in 2019. So that's about a 50% increase, not quite a 50% increase there. So part of it could be drug overdoses related to people being inside more and getting depressed. I don't know. Was there an increase in suicides during the COVID-19 pandemic among people 18 to 49? We just don't know, but somebody needs to look at this data and somebody needs to explain it. And, folks, I'm wagering you probably haven't even heard about this yet because I don't see it anywhere on the news while they're talking about, the Russian troops are about to invade Ukraine and et cetera, but nothing about the fact that our own people are dying all of a sudden in huge numbers over the last year, and these are working-age people, 18 to 49. Something's got to explain that. So we'll keep you posted on that story. If we come up with any hypotheses ourselves, we'll certainly share them with you, but we'll be scouring the news, trying to see if some wise individual finally comes up with a basis to explain this, or perhaps some data scientist analyzes the data and gives us a decent answer. And we'll keep you up to date and informed on that. Thank you for listening to the Morgan Streetman Show. We hope you enjoyed what you heard, and if you did, please click like and subscribe to help us out. And remember that we recommend that you exercise your brain at least once a week.